Hello, I'm Susan Coakley, the interim president of Beacon Health Options. During the month of June, as part of our Perspectives with Beacon Health Options seminar, I was fortunate to host an hour-long discussion with several of our clients. This session was called COVID-19's Impact on Employee and Member Behavioral Health Programs, and it focused on issues of the pandemic that were important to our clients. In total, 275 valued Beacon clients joined us for a conversation with 5 panelists from key industry segments. And today, we're delving deeper into the same topic with one of our previous guests from Yale New Haven Hospital. George Bud Wassell is responsible for the Employee and Family Resource Program for the Yale New Haven Healthcare System. George is a licensed professional counselor. He's taught mindfulness-based programs to employees to increase resiliency, reduce stress, and prevent burnout. Yale New Haven System received a corporate award for excellence from the Employee Assistance Society of North America in 2018 under Bud's guidance. Additionally, Yale New Haven has recently won the Greater New Haven Chamber's Healthcare and Life Sciences Council Award for Wellbeing and Wellness Programs for their work in supporting employees through the COVID-19 pandemic. So it's good to talk to you again, Bud, and congratulations on the recent Chamber Award.
Thank you. Thank you very much, Susan.
I'm really glad you're here today, Bud. So
great to be here.
Wanted to pick up on our conversation last time, and I have a couple of questions for you. So last time, during the panel discussion, you mentioned that you were most concerned about frontline workers, particularly those that are hardest to reach. So first, can you share a little bit with us today on how they're doing now, and what did you try to do to reach this group?
Sure. Yeah, one of the things we did right off the bat, after things slowed down a little bit, so we probably had maybe about a month of kind of breathing room, did an after event review. And so a number of leaders and as well as our wellness and all the folks who were involved in healthcare support talked about things that we did well and things that we could have improved on and ways that we could have reached those folks. One of the things that came out of that was something we're right in the midst of now, and it's basically a well-being check-in. And these are half-hour sessions scheduled first with the main people who are involved, particularly the caregivers, but we're also trying to include the EVS, the folks who clean the rooms, yeah, and the patient transport people, and a lot of the security, a lot of the support people as well. And what that involves is they sit down with a mental health clinician, some of our folks from the program and some of the social workers from the system, and they kind of go over actually a scale, the acute stress disorder scale, but it's more meant to be an educational thing. We don't even collect the copies, it's more for them to know what their score is. And it goes item by item, and it gives the clinician a chance to talk to the caregiver about, what were some of the challenges they faced during that time, especially in the midst of the difficult time. And there is a score to it, and if you score over a certain amount, you get referred directly to our EAP, which is called our Employee and Family Resources Program. We had provisions in place just in case if somebody really needed immediate attention. We haven't had any of that being used at this point. So we started at Greenwich Hospital. We've moved to Bridgeport Hospital. We were now going to Lawrence and Memorial. We'll be coming to the Yale New Haven Hospital after that. But basically in this staggered fashion, we're going to reach any caregiver who wants to. And basically it's an opt-out, so they get scheduled with this appointment by their manager. They can opt out, but what we're finding is, maybe 75, 80% are coming to those sessions. Wow. And they're protected time, so it's during their shift, and it's all confidential, of course. Nobody knows what was discussed. And they take that scale with them. And they learn a lot about EFR as well as the other internal resources that are available. So the last go-around, we had 75 people were seen within a few week period, face to face, and then we did extend it to Zoom sessions as well. So that's one of the things that we did, and I think that's really been a nice proactive outreach to them.
Wow, that sounds like a great program, Bud. And so what differences are you seeing between face to face and Zoom in terms of utilization or outcomes or or other qualitative aspects?
Right. Well, for that program, it's too early to tell because the Zoom sessions are just happening. In fact, they're not even Zoom. They'll probably mostly be phone sessions. And that's just happening like this week. So we won't have any way to really compare that for a while. And it'll mostly be anecdotal as well, but we will review that for sure. So yeah, but we've done a lot too. We've done a lot more of other things that we've continued with all of the staff, but particularly outreaching to the front life staff. Just as an example, we started an Oasis room system, so there would be a quiet room where people could go, and these are mainly the people who are involved in the COVID rooms, treating COVID patients. So if they needed a break, they could go to one of these rooms and just sit, do a meditation, or just be quiet just for a few minutes. And that was protected time as well, so they could really get away from the heat of the moment.
Yeah.
So that's going to continue. We've decided that we're going to try to keep some of those rooms in place because, that's whether we're in the midst of COVID or not, our folks are dealing with, very stressful situations, even just in the normal course of business, especially in the ICUs and the emergency departments, cancer care, pediatric care, those kinds of things. So we're going to continue those. The other big thing that we've done, which wasn't just our program as part of that larger healthcare support team that convened, is we created a buddy system. And this is something that we're really beginning to encourage a lot more now, so that each person is encouraged to have a buddy. In other words, a coworker who's in a similar role that they can touch base with at least once a shift and just check in, even if it's a text or a phone call, and just say, how you doing? Is everything okay? Are you eating well, sleeping well? How you feeling? That kind of a emotional well-being check-in with the buddies. So that's happening now, and we are actually going to be increasing that too going forward, so that we hope to have really good participation in that program.
Boy, it's fantastic. It sounds like you really have thought of so many, large and small issues to make this program effective. But you mentioned that people receive a score. Those who go through one of the sessions receive a score. Do you have enough data yet? Do you have a sense of how many people are referred? Is there a bell curve there? Are there any learnings or observations you can share with us on what you're seeing so far?
Yeah, absolutely. Out of a group that we did recently, out of, I believe it was 80 people who were screened, about 10%, so about 8 of those were referred to EFR. And that's an active referral. So we say to them, look, I want to put you in touch with the program. We can make a call right now, or we can go on we have the new My Beacon Wellbeing platform as well, so they can go right on and schedule an appointment online. So about 10% are being referred. I think what we're really seeing is that even though it was an extremely high stress time and prolonged, our people are pretty resilient. And that's kind of a lot of the feedback that we heard during the midst of it was, hey, I don't really need counseling. I need to get home to my family. I need to take care of the things that I need to do to keep safe and to keep my family safe. That's what people were really focused on during those times.
Yeah.
So
really helpful, and definitely will want to learn more and hear more about this program as it continues.
Yeah, great.
So Bud, I'm going to pivot a little bit now, look ahead toward, it's August now. People are beginning to think about back to school, the fourth quarter of the year. Some states are in phase 3 of their, their reentry programs. We're beginning to think about flu seasons ahead. So what are you doing to help prepare your workers, your frontline workers, for this next season, to managing a pandemic with families going back to school, with perhaps managing a pandemic with a flu as well? That's on the horizon for you and your workers.
And we've heard a lot of that from our workers too, that they are concerned about that. But the other flip side of that is I think they're also feeling like they're better prepared than ever. They're better prepared clinically on the floors. We know we have enough supplies and all that. So there's been an awful lot of communication about we're ready for this if it happens again. We've been through this and we're ready for this. So there has been a lot of communication, specifically through our leadership town halls that have been happening once a week, and they will continue to be happening. And then we're also going to do a couple events coming up. One will be kind of a resilience and well-being town hall. That's going to be in the fall, that people will be encouraged to, and of course it'll all be done on a Zoom platform in a webinar format. And that will be to inform them about all the available resources and to help them with some concrete action steps. And like you mentioned, we are definitely communicating about the childcare issue, going back to school. Beacon has been great because there's lots of good information on the website that people can go and get some information for themselves. There's a specific program in Connecticut where there's caregiving, child caregiving resources, particularly for healthcare providers. So, and we have a whole, our own daycare centers also have helped a lot with that too. So they're providing a lot of information when it comes to that. But I think it's really going to be also just trying, because nobody knows what's happening with the schools. So I think we'll want to also communicate about that. You can even call EFR just for help and consultation through the work-life services, for example. So we're going to really try to keep that front and center so people know that they can reach out through our program and through other resources. The other thing I want to mention, that one other thing that we've done, and I know it's not for everybody, but we do a pretty strong mindfulness meditation program. And in the past, we've done classes. So there, it's been great because people will come to the class and learn. But we realize not everybody can attend those. So in August, so we just started it yesterday, we started a mindfulness challenge. And this is so anybody can sign up, and they get pre-recorded videos and with a meditation and a little bit of lesson. And it's focused on how can you kind of, well, we call one of our webinars Survive and Thrive into the days ahead. So it'll be talking about those kinds of things. So we're hoping to have good participation. And from the beginning, it looks like we do so far. So those are the couple of things that we're doing. One other thing I do want to mention, it's one that we've been doing a lot already, but this has kind of kick-started our emotional well-being and resilience programs. So now we have a new structure called WELD, which is wellness, engagement, and learning and development. And it's a whole structure that's taking place, and it's really taking off on a lot of what we've already done, so that we can kind of catch the wave and continue this into the fall to reach everybody, but particularly the folks on the front lines.
That's great. Again, it sounds like you have incredibly comprehensive programs, and you're kind of touching on the themes of resiliency, flexibility, keeping committed, and it sounds like mindfulness is a very core element of these programs. They sound wonderful.
Yeah, it's one of the tools for sure. We also have a very strong wellness program called Living Well Cares, and they've been out there and they've been seeing an increased number. We have a new, every year we do biometric screenings, and it's called Know Your Numbers.
Yep.
Now this year we're not doing the screenings because you can't do them face to face, but so we changed that whole program, and there is a resilience questionnaire that if you take that as one of the credits, then you get information on the other well-being services, including EFR and those various all different kinds of options for your emotional well-being that people can follow up on. So we're doing a lot of follow-up activities, really trying to keep that front and center. That's
great. And it's interesting to hear how you've adapted programs for, our new situation. So that's a good segue for telehealth. I think telehealth has been really kind of one of the, I think unsung hero is an understatement, maybe the MVP, one of the MVPs of this crisis. So, at the June discussion, you and the other panelists had extensive conversations around telehealth, increased utilization. Are you seeing people continuing to adhere to continue to take advantage of telehealth? Are you getting other feedback from your from your constituents that you'd like to share with us today?
Yeah, we are getting good usage of that new platform again, the My Beacon Wellbeing, where you can go online and schedule. So we've had a good number of cases. I'm not sure how it is comparatively. It'll be interesting to compare next year, for example, quarter to quarter. In the beginning, the utilization really wasn't that strong. I think it's getting stronger. We're expecting even more utilization. And of course, right now, it's all telehealth. So your network is all telehealth. We have 2 counselors in New Haven, which is our biggest population, that we're on-site counselors. They're doing all Zoom sessions. And they're really saying that people are enjoying it, are finding it valuable, that they feel as the clinicians, they're making the connection. In fact, in some cases, that people have felt more open to maybe talking about some things that they might not talk about face-to-face. So it seems to be working well. And I think in the long run, people will go back to face-to-face once we get there. But I think this has made a tremendous impact into how people realize that you can do a lot on a video session. And that is very convenient. And I've done it myself in my own private practice where I've met with clients, and it works quite well. So I think it really opens up a lot of possibilities.
I agree. And I think we're just at the beginning of this journey. I think things will change as we get into newer, once we get past the pandemic, which will be, quite a while till we get back to that,
right,
normal, and then kind of post pandemic.
Yep.
But I think we're going to learn a lot from this. And this is just the first chapter, I think, in what
right.
time is going to look like.
Right.
So I'm going to, we're getting close on time. So I want to have, make sure I hit this question, and a topic that's very important to me and very important to Beacon. We're not faced with one pandemic right now, but we're really faced with 2.
Right.
The coronavirus pandemic and the realization of systemic racism and its impact on really all aspects of our society, including mental health. We're talking a lot about it at Beacon. We all have just closed out Minority Mental Health Month, not necessarily the best name for that naming for that month. I think that title will adapt to be more modern language. But can you share a little bit about what you and your team are doing as it relates to diversity and inclusion in healthcare?
Yeah, sure, absolutely. And we do have a very diverse employee population as well. And so I think one of the biggest things that our leadership did in the beginning was just did a lot more listening. But then they have held diversity and inclusion town hall meetings called Let's Talk. And they've had a couple of them. They just had one last week, a dialogue on race. And they have we have a very strong diversity and inclusion department, which has councils in each of our hospital delivery networks. And so representatives from those councils were on the panel. So that was one of the things that they've done recently. We have another event called A Journey to Self-Love and Acceptance that just happened late last week as well, with a life coach and motivational speaker who was the guest speaker of that. And then, but I think the other thing which has a lot more direct impact is a lot of the leaders in the different hospitals, again, set up panel discussions. And these have already happened. So they set up discussions where they talked about the impact that it had on them personally, and on their families and on their communities. And then there was an opportunity for folks to ask questions and make it a real dialogue too. So I think those had a lot of impact. And I think it's increasing awareness. The diversity inclusion have a very strong educational component. So since March, of course, all their sessions have been on Zoom. They're now back to doing in-person sessions internally. And those are on, like Ouch, That Stereotype Hurts, Defeating Unconscious Bias, cultural competence in healthcare, those kinds of things. So we're addressing it from different angles and on different levels.
So, Bud, anything else we can be doing for employees?
Well, one of the things that I've been very happy about and grateful for is just the all hands on deck kinds of effort that we've had from so many different people around our health system. I mean, usually it's myself and EAP and a few other people, the wellness people, of course. But now everybody's like wanting to help out with our emotional well-being, which is really fantastic because it really blends it into the whole physical well-being, nutritional well-being. And I think that's really going to be the super outcome from all this is it's going to make that part of just the usual way that we do business. It's going to make it okay to ask for help, I hope, on a number of different levels. And we're going to all be paying a lot more attention to our emotional well-being. So very happy about it.
That's great. It is wonderful what you're doing. The work is destigmatizing and it's focusing on the whole person. It's really terrific.
Yep, absolutely.